15 minutes. 15, 1 5, 15 minutes. So, in the uveitis, there is an anatomical classification we will learn. That is, firstly, the anterior uveitis, in that iritis, iridocyclitis, and cyclitis. And second is the intermediate uveitis, in that there is an inflammation of the pars plana and the peripheral part of the retina and underlying the choroid. So it is called as a pars plana. And in the posterior uveitis, so in the posterior uveitis is referred to the inflammation of the choroid, that is choroiditis, and always there is an associated inflammation of the retina, and hence the term is chorioretinitis is used. So there is a inflammation of choroid, that is the posterior part. So it is called as a posterior uveitis, and it is always associated with the inflammation of the retina. As retina in choroid is as a near distance, so there is a term that is the chorioretinitis is used, and panuveitis. So it is the inflammation of the whole uvea. So there is a inflammation of the whole uveal tract, then it is called as the panuveitis. So this is all about the clinical classification of, this is all about the anatomical classification of the inflammation of the uveal tract, that is uveitis. Next is the clinical classification of uveitis. In that, first is the acute uveitis and second is the chronic uveitis. In that, when we learn about the acute uveitis, so it has got a sudden symptomatic onset and the disease lasts for about 6 weeks to 3 months. So it has a sudden onset. That's why it's called as the acute condition. And this is last for a 6 weeks, that is 1.5 months to the 3 months. And the chronic uveitis. So the chronic uveitis, it frequently has an insidious and asymptomatic onset, and it persists longer than the 3 months to even year, and usually diagnosed when it causes a defective vision. So, chronic uveitis shows the chronic inflammation of the uveal tract. So, it frequently has an insidious and asymptomatic onset. There is a no symptom is seen in this chronic uveitis, and it persists longer than a 3 months. So, it 2 even year, it usually diagnosed when it causes a defective vision. Third one is the pathological classification. So, in the clinical classification, there are two types, that is acute uveitis and chronic. Okay. Then third is the pathological classification, in that there is a suppurative or purulent uveitis and non-suppurative uveitis. It has been further subdivided into the two groups, that is the Woods classification and non-granulomatous uveitis and granulomatous uveitis. So when we can study about the pathological classification, there is a suppurative or purulent inflammation of the uveal type. So there is a suppuration, means there is a pus formation in the inflammation of uveal tract, which is also an important type of the pathological classification of uveitis. And second one is a non-suppurative uveitis. It means there is a no pus formation in such a condition of pathological classification of uveitis. And this non-suppurative uveitis is has been further subdivided into the two groups, that is the Woods classification. It is in that first one is the non-granulomatous, that is there is a, and second is a granulomatous uveitis. So again in non-suppurative there are two types, non-granulomatous uveitis and granulomatous. Fourth one is the etiological, that is the Duke Elder classification. In that, there are the six types of uveitis, that is, infective uveitis, allergic uveitis, toxic uveitis, then traumatic uveitis, and uveitis associated with the non-infective systemic diseases. And sixth one is idiopathic uveitis. So this is a etiological classification of uveitis. So when there is an infection, then it is called as infective uveitis. When there is allergic reaction, so uveitis due to an allergy, then it is called as allergic uveitis. And toxic uveitis, when this is occurred due to the toxic substances, then it is called as a toxic uveitis. And traumatic uveitis, it is the inflammation of uveal tract due to the trauma to the organ. And fifth is a uveitis associated with non-infective systemic diseases. So, firstly, in the patient there are systemic diseases, but which are non-infective. Then it leads to the uveitis. Sixth one is idiopathic uveitis. So, this is the last last one type of the etiological classification of uveitis. So when we study about details in about the infective uveitis, we can see that in this there is an inflammation of the uveal tissue and is induced by invasion of the organism. So the uveal infection may be exogenous, secondary or the endogenous. So when infective uveitis is due to the invasion of or the organism. These are exogenous, secondary, or endogenous. So, in the exogenous infection, firstly, where the infective organism directly gain the entrance into the eyes from outside, and it occur following penetrating the injuries, perforation of corneal ulcer, and post-operatively after the intraocular operation. So when there is an exogenous infection occur, that is infecting organism is directly gain entrance into the eye from outside. So from the outside, the infecting organism it directly gain entrance into the eye. Then it lead to the exogenous infection, and it following due to the as penetrating injury or the perforation of corneal ulcer or post-operative, that is after the intraocular operation. So these are the example that how there is a direct entrance of the infective organism into the eye and which lead to the infective uveitis. Second is a secondary infection of the uvea that occur by the spread of the infection from the neighboring structure. That is, for example, there is acute and purulent conjunctivitis due to the pneumococcal and the gonococcal, and keratitis, scleritis, retinitis, orbital cellulitis, and orbital thrombophlebitis. So, when there is a secondary infection of the uvea is occur, there is a spread of the infection from neighboring structure. So when there is a neighboring structure is inflamed, then this inflammation is spread into the uvea which lead to the secondary infection. That is, for example, like acute purulent conjunctivitis due to the pneumococcal, gonococcal infection. Then there is a keratitis, scleritis, retinitis, orbital cellulitis, and orbital thrombophlebitis. Then it lead to the secondary infective uveitis. Third one is the endogenous infection. So these are caused by the entrance of the organism from some source that is situated elsewhere in the body and the way of the bloodstream. And endogenous infection play an important role in the inflammation of the uvea. So when there is an endogenous infection and which are caused by the entrance of the organism from some source that is situated elsewhere in the body by the way of the bloodstream, and endogenous infection play an important role in the inflammation of the uvea. So when there is an inflammation of the uvea, it leads to the, and due to the endogenous, that is the organism which is situated in the body, and by the way of bloodstream, it goes into the eye and in uvea and lead to the endogenous infection. Okay. So this is all about the infective uveitis. Then, when we study the type of the infectious uveitis, so depending upon the causative organism, the infectious uveitis may be classified as follows. So, first one is a bacterial infection. In that vein, these may be a granular matters. For example, tubercular, leprotic, syphilitic, then brucellosis or pyogenic, such as the streptococci, staphylococci, pneumococci, and the gonococcus. So, when there is a bacterial infection is due to the presence of the bacteria, that is tubercular, leprotic, syphilis, brucellosis, pyogenic, streptococcus, staphylococcus, pneumococcus, gonococcus. These are the many bacteria which lead to the granulomatous infection. Then this is the main type of the uveitis, that is infectious uveitis due to the bacterial infection. Then second one is the viral infection. So, it is associated with the uveitis are the herpes simplex, herpes zoster, cytomegaloinclusion virus, that is the CMV. So, these are the types of the virus like herpes simplex, herpes zoster, and cytomegalovirus, that is CMV, which lead to the viral infection of the uveal tract and which lead to the infectious uveitis. Then the fungal uveitis. So it is a rare and many accompany a systematic aspergillus, candidiasis, and blastomycosis, and it also includes a presumed ocular histoplasmosis syndrome. So fungal uveitis is a rare condition. It is not like a bacterial or a viral that is common, and fungal is a rare. So it may accompany a systemic aspergillosis and candidiasis and blastomycosis. So it also includes a presumed ocular histoplasmosis syndrome. Then fourth one is a parasitic uveitis. It is known as known in the toxoplasmosis, toxocariasis, onchocerciasis, amoebiasis, and fourth is the rickettsial uveitis, that it may occur in the scrub typhus and epidemic typhus. So the parasitic uveitis is known in toxoplasmosis, toxocariasis, onchocerciasis, amoebiasis, and rickettsial uveitis, that is due to the scrub typhus and epidemic typhus. So when we studied the type of the infectious uveitis, that is depending upon the causative organism, and the infectious uveitis may be classified as follows. That is, first one is a bacterial infection that due to the many bacteria, that is tubercular, leprosy, syphilis, brucellosis, pneumo, strepto, staphylo, gonococcal, infections lead to the uveitis, then it is called as the bacterial infection. And when there is an infection due to the virus, like herpes simplex, herpes zoster, cytomegalo, then this is called as the viral infection of the uveitis. And when this is due to the fungus, that is like aspergillus, candidiasis, blastomycosis, then it is a fungal infection. And when this is due to the parasitic, like a toxoplasmosis, toxocariosis, like amoebiasis, then it is a parasitic uveitis. And when it is due to the rickettsial, then it is called as a rickettsial uveitis that may occur in the scrub typhus and in the epidemic typhus. So this is all about the types of the infectious uveitis. So in the next lecture, we will learn about the allergic uveitis and the further topic of the diseases of the uveal tract. Till that, we end today's lecture. Thank you, student, and have a good day.
मॅम ऐका ना.
बोला.
मॅम आपल्या जर्नलचं काय करायचं?
जर्नलचं काय करायचं? ठीक आहे, मी बोलते शेख मॅडमशी आणि सांगते तुम्हाला. ठीक आहे, बाय.
चालेल मॅम, कारण की मॅम आपले जर्नल लिहायचं राहिलंय ना, मग ते लिहून घेतलं असतं.
बरं बरं. मी एक जागृती म्हणून एक स्टुडंट आहे.
हा.
तिला मागे सांगितलं होतं जर्नल विषयी सगळं. प्रिया शेटे मॅडम, थोरात मॅडम आणि शेख मॅडमशी बोलून. तिला मी फॉर्मॅट
हा.
पाठवलं होतं. ती म्हटली मी सगळ्या स्टुडंटला सप्लाय करते म्हणून. मग तिने काही
हो मॅम, ती बोलली तुम्ही जे सांगितलेलं तिने ते सांगितलं.
हं,
पण मॅम मग नंतर थोरात सर बोलले का तुम्हाला इन्फॉर्म करतील मॅम, तसे तुम्ही लिहा
काय घ्या?
जर्नल. म्हणजे तुम्हाला मॅम सांगतील कसं लिहायचं, काय लिहायचं, मग
ओके.
तुम्ही लिहायला चालू करा.
ओके, मग तुम्ही स्टार्ट नाही केलेत अजून?
नाही.
बरं. कोण बोलतंय?
मी करिश्मा बोलते,
करिश्मा.
दाभणे.
ठीक आहे. मी बोलते थोरात सरांशी. हं, ठीक आहे. आणि मग तसं तुम्हाला कळवते. ओके?
हा हा.
हां. तुम्ही कुठे आहे
चालेल
आता?
मॅम. आता मी घरी आहे.
बरं बरं. जर्नल्स आहेत तुमच्याकडे?
जर्नल्स काही जणांकडे आहेत, काही जण घेतायत आता.
बरं. मी कळवते तुम्हाला. हां?
चालेल चालेल. थँक यू मॅम.
हो, वेलकम.
हां, बाय मॅम.